Now a very interesting topic. This came in NEET PG 2023. Little ambiguous. So what is this? What has happened here? 90% NaOH. This is called as corrosive poisoning or corrosive injury. And corrosive injury can happen in two ways. It can be consumption of acid, but it is less severe with acid because when there is acid injury, you get a coagulative necrosis. So acid injuries are better tolerated, lesser damaging. You can get alkali injury, and that leads to liquefactive necrosis, which is much worse. Liquefactive necrosis, because it will keep going deeper and deeper and deeper. Whenever there is a corrosive injury, obviously, when the person has consumed the acid or alkali, he gets burning here. He gets ulcers in the esophagus. He can get ulcers in the stomach also, depending on how much the acid has gone. What do you do first? What is the first step? What is the first step? In any patient who is first stabilize the patient. First step will be stabilize. What do you do then after you have stabilized? Means IV lines, IV fluid, all that is done. Never do GI lavage. Perfect. No. Activated charcoal से acid बाहर नहीं आएगा. What you need to do is you want to know how much damage has been caused by the acid or the alkali. Means how much ulcers have happened. Is it esophagus? Is it stomach? Is it duodenum? So what you are going to do is you are going to do upper GI endoscopy. Okay. You may have to do a CT with oral contrast, but this can be done if you are suspecting perforation. Otherwise, endoscopy most of the times is sufficient. It tells you the severity of injury. Sometimes it's possible that it is completely blocked. Endoscope is not going only. Yeah, Zargar stating absolutely right. Zargar, bilkul sahi. It is correct. Something like me, ye naam sahi hai, Zargar. It is Zargar grading of esophageal injury. Endo say no, you have to do it carefully. Okay, you have to do it carefully because obviously this is a high risk case. But zaruri nahi hai na that it may be bad. Maybe you just consumed a sip. If it's only a sip, तो अंदर ज़्यादा damage नहीं होगा. You want to see that how much it is damaged, and after you assess that, you have to get something for feeding. Now, what feeding you establish depends on how bad the injury is. If it's little injury, not much, you can simply give him nasogastric feeds or nasojejunal feeds. But if it is severe, then you may have to do a feeding jejunostic. Since it is severe here, complete dysphagia, your answer will be feeding jejunostic. So endoscopy, at least, if endoscope is not able to go down because it's very injured, very inflamed, then you will do CT. But starting will be endoscopy. If there is a perforation, then you can't do endoscopy, then you will do CT. Okay, but normally in corrosive injury, perforation nahi hoti. Normally nahi hoti. Feeding gastrostomy can be done if the stomach is okay. If the stomach is okay, if acid has gone till stomach, तो gastrostomy bhi nahi kar sakte. After all this is done, later on what you are going to do is, then you do observation of the patient. Observe, conserve, till whatever injuries happened, they started healing. Till they start healing, this takes a few months. Normally it will take 1 to 3 months. Periodically you will do endoscopy. Once all the ulcers have gone and it has formed strictures, then you will do a reconstruction. Okay, you will do reconstruction after all strictures are formed. What I am telling you is the most sensible way to go about it.